It's okay, Gloria.
Oh, Papa. Oh,
Mama, we're going to meet some very nice people today. They're going to help us take care of you.
I'll go.
Okay. Yeah?
Hi, I'm Janet, your hospice nurse.
Oscar, we spoke on the phone.
Yeah, nice meeting you.
Please come in. My wife will be Ryan.
Thank you.
Hi, Janet. Thanks for coming.
Of course, happy to be here.
I'm off to work. Nice to meet you, Janet. Bye, amor.
Right, nice to meet you. I've already spoken with your mom's doctor and I'm up to date with all the details.
That's great. Thank you.
And this week you'll meet Miriam. She's a terrific social worker.
Yes, we spoke when I set this up.
Good. I'd love to meet Gloria and learn about your daily routine and how things are going. Where is she?
She's resting in her room. Shall we? We just bathed her, so she's tired.
How do you manage the baths?
My husband and I bathe her every other day. It's challenging.
Have you considered sponge baths? A sponge bath is as effective and maybe more comfortable for her. We can also arrange for a bath nurse to demonstrate or come 3 times a week to take over if you need. How is she sleeping?
She sleeps more during the day now. Some nights she's up for a while. It varies. Mama? Mama? This is Janet. She's here to help me take care of you.
May I touch your mother's hand? Hi, Gloria. I'm your nurse, Janet. It's nice meeting you. Are you having any pain? Good. I'm here to make sure you're comfortable and have everything you need. You have a very nice setup. The bed rails, an overbed table. We can provide any other equipment and supply needs that come up. Adult griefs, oxygen tanks, or anything else that aids with the disease or decline.
That's great. I didn't know that.
You just let us know and we can deliver it. Gloria, your daughter takes very good care of you. What a gorgeous picture.
That was a little over a year ago at my daughter's wedding.
Gloria, you look radiant.
My daughter and son-in-law decided to push the wedding date so that my mom could really be present. We had a wonderful time. She was so happy. Everything's changed so much. Hi, Mama, you're being pampered.
Mama. Doctor.
We did a head-to-toe assessment. Gloria doesn't have any bed sores, which is very good.
We're very diligent about repositioning. Right, Mama?
This soup smells delicious, Gloria.
Mama, it's time to eat. Hopefully she eats. This morning she refused. Mama, please eat. Please. She's afraid to swallow. She choked, so I don't know what to do.
Unfortunately, it's normal. We can give you a product called Thicket, which helps to make it easier to swallow, but as Gloria progresses, it will become more difficult for her to swallow. Sometimes she won't want to eat, and it's okay to listen to her body.
So I let her stop eating?
At some point, yes.
Will she need a feeding tube?
That's not recommended for someone with late-stage dementia.
I can't let her starve.
No, she won't starve. There will come a point when the body won't know what to do with food or drink. It would be like putting gas in a car that doesn't run. It won't need as much gas. It's better to listen to the body. Have you filled out a pulse form?
I don't know what that is.
PULSE stands for Physician Orders for Life-Sustaining Treatments. It's a form we use so family, doctors, and the whole care team honor a person's wishes during end of life. I understand your family wishes to keep Mom at home, no hospitalizations, correct?
That's right.
This form ensures that happens. So when the time comes, Gloria's wishes are respected. We can go over it.
Attempt resuscitation, CPR, or do not resuscitate. I never talked about this with my mom. It seems so morbid or bad luck.
But it's what we're facing.
Basically, it means choosing to resuscitate or CPR would require her to be hospitalized.
Medical procedures, intubation, mechanical breathing, artificially prolonging her life. Which one we don't want, right?
No. No hospitals. Not like my dad. It was awful. And I know my mom doesn't want that.
Then Gloria will prefer a non-invasive treatment, a comfort-focused treatment, a natural death.
She's in the next room and we're talking about her. I can't even say it.
I know, Amor. It's something that we don't talk about, but we need to.
What if it's not the right choice? I'll never forgive myself.
I believe what you decide will be right. You know her best.
I know she wants to be at home with her family.
Then that's what we'll do, okay?
So how did it go with Nurse Janet?
It went fine. It's a little odd. I've been my mom's caregiver since her diagnosis.
Of course, this is all very new. There's still a lot of stigma around hospice.
I'm still learning how it works.
Well, our goal with hospice is to make sure that Gloria is as comfortable as possible. We hope to preserve respect and dignity all through her life.
I take good care of my mom.
Of course you do. I'm sure the best care. My purpose as the hospice social worker is to help you and your family navigate through this time. I'll keep you connected to all the resources that you need so that your mom is safe and comfortable.
That's what I want. For my mom to feel loved and cared for.
Absolutely. And how are you feeling?
I know the disease is in the late stage. I'm still trying to process. terrified of losing her.
Well, you know, sometimes knowing what's to come can lessen our fears. I know it can be scary, but it is important that we talk about death as part of life. Is it okay if we talk about it?
I can barely say the word.
Well, for me, end-of-life care is sacred. Many people plan for a good birth, but very few people plan for a good death. Planning gives us an opportunity for loved ones to have a peaceful transition. It can also make the experience less traumatic for the family.
I never thought about that.
With hospice, you get a team working together to support you. You have me as a social worker, you have a physician, a group of nurses, and a chaplain.
I didn't know all this was available.
This is what hospice is. We make sure you get the best care 24/7.